Good morning, everyone. Happy Wednesday, and thank you so much for joining today's webinar, Menopause Demystified, Understanding the Change That Changes Everything. We are so excited to have you join this empowering and eye-opening webinar and learn how to support not only yourself, but those around you. Today's session is led by Patrice Rolle, Menopause Executive Coach and founder of Menolux Health and Wellness Coaching and Consultancy. This session will help us break the silence around menopause and its impact on life and work. Please join me in welcoming Patrice Rolle. Patrice, you can take it over.
Good morning, everyone, and thank you, Janae. Thank you to CG and Zest Wellness for having me here to present this very timely topic, menopause. And before I go into the webinar, I will tell you my story and how I had my menopause journey. In 2017, I was at the peak of my career, and I was doing all of the meetings, the board meetings, and I started experiencing hot flashes, sleep disturbances, irregular periods, and I chalked it up to being burnt out. With anxiety and depression, the thinning hair, the dry skin. My doctors really never prepared me for all of that, but I had to figure it out. I discovered hormonal replacement therapy here in the Bahamas, and the form that they have did not work for me. I ended up having thrombosis and hypertension, and so I had to do my own research. But at the end of the day, I was able to manage my symptoms, finding a doctor in the US that assisted me with that. And so I became my own advocate, and a light bulb went off in my head. And I'm like, if I was suffering, and I'm a very curious person, imagine other women who are going through and they're suffering in silence. And so I decided to form the company Menolux, here to give the education, the support to women who are going through menopause, perimenopause, or postmenopause, or even just curious about what really is menopause. And so, to quote a very popular women's rights writer back in the 18th century, her name is Mary Fuller. She says, "If you have knowledge, let others light their candles in it." So that's what Menolux is here to do. We're here to give knowledge on menopause. So now we're going to go into the actual webinar. So we talked about Menolux already, but we do offer one-on-one coaching for individuals, and we do executive coaching for corporate companies. It's a 3-tier corporate training, one for staff and executives, and we have one for HR for policy development for menopause inclusion, and then we have a training for menopause champions in the workplace. And of course, our mission is to normalize menopause. So let's dive right into the information. And before I do that, I want to say that this is a conversation more than it is just me presenting. So feel free to ask questions, and we'll see how best we can give you your answers today. So why are we talking about menopause in the workplace? So menopause impacts almost, if you live long enough, it impacts every woman. You're going to get there. I've had women say, well, I don't think I'm gonna go into menopause because my mom never went into menopause. But that does not mean that that would happen. But in surveys, 60% of women say that menopause impacts their work. And 1 out of 10 women in the UK leave their jobs altogether because of symptoms that they don't even understand. But here in the Bahamas, menopause is really not talked about. There's silence, there's a stigma around it, and women suffer in silence. And sometimes these women are at the peak of their career, and they don't understand what's going on. And at that time, these are talented women who have had years of experience to continue on in the company and give back through mentorship, and they're contemplating either leaving the job or taking time off. So menopause is not just a personal issue, it's a workplace, economic, and a leadership issue. So training like these creates the opportunity for empathy, education, and true workplace inclusion. What is menopause? I think this is the million-dollar question. And it's very simple. Menopause really marks the end of a woman's reproductive years. A lot of people say, well, how is it that simple, but yet there are so many symptoms around it? But the clinical definition for menopause is 12 consecutive months without a menstrual period. But that's the medical definition, and each woman experiences menopause in a different way. And so another neurologist, Dr. Lisa Mascani, said that menopause is a neurological and an endocrine transition that affects women physically and mentally. And hearing that made me think twice. Hearing that made me think twice about the connection between menopause and dementia, because we're having a lot of research around that. But I think that as we do more research, and there's more research being done around menopause, we're going to get a clearer definition of what menopause really is when it actually happens. But for today, we're going to use the clinical definition. Menopause has 3 stages. You have perimenopause, and this can happen between the ages of 35 and 45. And sometimes symptoms that come along with perimenopause can last anywhere between 4 and 10 years. And I know that makes some people panic. That is a very long time, but when you are in perimenopause, this is the period that some people refer to as the storm. Because during this time, you begin to see all of the symptoms that come along with menopause. And sometimes we see it and we don't recognize it. And one of them would be irregular periods, your mood swings, sometimes you're forgetful, and sometimes you're losing sleep, you have sleep disruptions. This is the time when women think, I'm not sure what's going on. Maybe I just need some rest. I just need a vacation. But that definitely is a sign that you are in perimenopause. And then the next stage is menopause. And again, this is 12 months without having a menstrual cycle. And that marks the end of your reproductive years. Now, exactly 1 day after the 12 months, you're considered postmenopause. And believe it or not, ladies, that is for the rest of your life. I've had a client ask me, she said, I've been through the changes, and I don't have to go through all of those symptoms that I've had before, but I can tell you that definitely is not the case. Some women have said that they've had symptoms that come and go. But again, it depends on a lot of different factors in a woman's life. But let's just take a minute and look around the room. And every woman, your friend, someone you know, your sister, your aunt, your cousin, they are going to go into menopause. And they definitely need to be aware of what to expect and how to prepare. So this information is very timely. I think it's not only just for women in menopause, it's also for younger women, I mean, women of all ages. You want to know what's going on and how to prepare. On another note, we have actors who are now very big in the advocacy role for menopause, like Halle Berry and Naomi Watts. And we have Oprah having a whole show around it. She had an award ceremony early in the year, menopause, and giving awards to doctors who actually took the initiative to go ahead and go back to school and learn about how to treat menopausal women. And so, even ones that are writing books, spreading the information, lobbying the government to change policies on menopause. And so it's definitely a movement at this time. And rightfully so, it's overdue. And one thing I have learned is that doctors have not had enough training on menopause and the symptoms. I think the statistic says that doctors have had between 1% and 3% training in the entire school on menopause. And so that speaks volumes for us as women that we're underserved in this area. And so there is some confusion around it. You go on Instagram and you go on TikTok and you hear all kinds of stuff about menopause and what to do, what not to do. But definitely platforms like this can give you the information that you need so that you can make an informed decision when you are preparing for menopause, whatever stage you're at. So why do women go into menopause? Other than the normal transition, which is the 12 months and the declining of the ovaries, there are other genetic factors, your family history. If your mother had early menopause, then you may follow suit and have early menopause. And sometimes women are just have predispositions that influence the time when they experience menopause. And then you have medical causes, which is the hysterectomy or complete hysterectomy, chemotherapy. When women have chemotherapy, some of the therapies are hormonal inhibitors, and so your body stops producing estrogen and progesterone, and you go straight into menopause. And of course, let's circle back to the hysterectomy. When you go through a complete hysterectomy, you go into menopause immediately. And so there are lifestyle factors, and I found this very interesting. Chronic stress, that is a big one. If you're dealing with chronic stress on a regular, that can prompt premature menopause. Even smoking can cause premature menopause, and other environmental toxins that can trigger early menopause. And when we talk about early menopause, we're talking about menopause happening before the age of 40. But statistics say this really affects 1 in 5 women. So there is a chance, I said reflect on where you're at, what lifestyle you're living right now, and that can really impact, how soon you go into menopause or how late you go into menopause. So, did anyone here know that stress could trigger menopause early? Okay, great. It's really something that we need to consider because I know we've heard in our society that stress is a killer, and we kind of normalize stress because I hear people on a daily basis saying, "Oh, I'm so stressed out," and honestly, we need to normalize eliminating or managing our stress better. So, this is a big one. And I know when you think about menopause symptoms, you think about hot flashes, mood swings, but did you know that there are 100 symptoms of menopause? I'll go through the common ones that we have listed here, hot flashes and night sweats, and they're really called vasomotor symptoms. We have the mood swings and irritability, brain fog and memory issues, sleep disturbances, that's a big one, irregular periods, weight gain, that's a bigger one. And then the lesser known ones, I'll just call out a few, itchy dry skin, frozen shoulders, burning mouth syndrome, tinnitus, which is the ringing in the air, dental problems, joint aches and pains. And then you have the psychological ones, which is depression and anxiety. And that is, again, another big one because we now have statistics saying that women between the ages of 40 and 50, they've been seeing an increase in suicide rates in women between those ages. And so they're linking that to menopause.
You have a question, what's burning mouth syndrome?
Well, just what it says, your mouth starts to burn. Which is so crazy because I had one of my clients and she had the burning mouth and then after that she ended up with an ulcer, but it was really a cause of or a result of
When you find out,
low
let me know.
estrogen.
Uh-huh.
It's really low estrogen because your body has estrogen receptors all through, and so it helps the body function properly. And when there's a disruption or a decrease in your hormones like estrogen, progesterone, and testosterone, your body is a little out of whack and things start to happen. Very strange things. For me, the strangest thing for me was blurry vision that come and go, and I didn't know that was attached or it was a result of the drop in my estrogen. So that's burning mouth, and not many women experience that, but it is definitely on the list. And then we have the memory loss and lack of confidence around this time because you're not yourself and you don't know what to expect. You don't know what's happening, and so you're trying to figure it out. And you were performing and living your best life, and all of a sudden things are happening, and it really does something to your confidence. So again, emotional, you're always on an emotional roller coaster, loss of motivation, and social withdrawals. And so that's only a few. Like I said, it's 100 of them. I hope Janae would send out the list. If anyone wants the list of the 100 symptoms, Janae will send it to you. Any other questions before we go on? Yeah?
Okay.
Okay, great. So when these symptoms happen, the question?
Can removing your womb still cause you to go into menopause? I heard it doesn't.
Well, the thing is, the ovaries, they are a part of the endocrine system that helps produce estrogen. And so some women who have had their
Sorry, can you mute yourself if you're unmuted?
So for a workplace impact, it really decreases productivity. I mean, you haven't had a good sleep, you're up at 3 o'clock for 3 nights in a row, and you come to work and you're just not there 100%. And so it really pays to understand what's going on with your body and to figure out how you're going to manage that and see if you can get your symptoms managed and under control.
There's another question. What can be done about the blurry vision?
Well, absolutely nothing, right? It comes and it goes. For me, I do bioidentical hormonal replacement, and that has taken on a new name. It's menopause hormonal replacement therapy. And so since I've been on it for the past 4 years, I haven't had the blurry vision. And so it's really not something that you can do anything about unless you go to your doctor and seek medical help with that. And again, some women are not opting to do the HRT or the MHRT. Some women would rather do the natural way. They would rather treat their symptoms the natural way. Any other questions? I love these questions. Keep them coming because I always say the more you know, and we'd love to share. No other questions? Okay, so we're going on to the next slide.
We do have one, but I'll mention it.
Okay, great. So let's talk about the hormonal shifts that happen in menopause. And this is why we're having all of these disruptions and all of these symptoms. So when menopause occurs, there are three main hormones that decline. You have your estrogen, your progesterone, and your testosterone. They influence the brain, the bones, the heart, the skin, and mood. So estrogen, and I want you to listen to this very, very carefully and take some notes because this is very important. Estrogen boosts serotonin, which is your mood stabilizer. And also dopamine. Dopamine helps with your motivation and your reward. And so there's also endorphins. Estrogen is tied to, and that's your natural painkillers, right? So when estrogen drops, women feel flat, unmotivated, and anxious. And that is huge because we have to show up every day. We show up for everyone. We show up to work. We show up for our children. And so when you have this disruption, it throws everything out of whack. It's not only just the master regulator for the brain function, heart and skin, it's all through the body. And so a lot of the functions in your body is tied to estrogen. And so we have progesterone. This is your calming hormone. I call it the GABA receptors. And so without it, sleep and mood suffers. And I think for a lot of women, this is a huge one. When you feel anxious all the time, I have a lot of women saying, what's up with the anxiety? Why do I always feel like I am in fight or flight? It's your progesterone is dropped. And so, that's going to keep you up. That's also going to keep your cortisol and your insulin high as well. But we'll get to that. We also have your testosterone. I had a very interesting question where someone said to me, do women actually have testosterone? Yes, we make testosterone, and it's very important for us. So, not being surprised, please. We do have testosterone. That's there for our energy. So when you have your low energy levels, note that your testosterone levels are dropping. And when you're going into menopause, that's the first thing that goes out the window. That's really tied to your libido as well, women. So testosterone supports the dopamine, driving confidence and focus. That's very important when you go on the job, or if you're attempting to take on a project, you definitely need to have your testosterone levels up. So cortisol and insulin, I think this has been something that has been talked about in the medical world a lot, and I call it word on the street because a lot of women stop me and say, what about that cortisol? That's really the one responsible for this belly I have in the front of me, all this extra weight I'm toting in my arms. And I'm like, well, yeah, it's the body is not prepared. Once your other hormones drop, your body's not prepared to take on the stress when you get older. And so, that change causes cortisol spikes and also causes you to become insulin resistant. And then you gain weight, and then you have these inflammation with the joint pains. And so all of these are tied again back to the other hormones because they all work in harmony together. So, I like to think that these help so well with the neurostimulators, which I just talked about, your dopamine and your serotonin. And so think about it, you're sitting, sometimes you're sitting down and you have this brain fog, or you just feel tired all of a sudden. It could be tied to, your shift in your hormones. Any questions before we go on to the next slide? Nobody's questioning the hormones. I'm surprised, but
For someone who's already diabetic, does this mean that their diabetes can get worse from insulin resistance?
I have heard, I've had a client that it has happened. But again, if you're practicing a healthy lifestyle, you should be fine. Your body, when these hormones shift, it's really telling you that, hey, we have to take better care of ourselves. We have to know what's going on. I don't know about anyone else, but I work for myself, but when I was on the job, I was always rushing to either finish the kids, get to work on time, finishing a project. And so I never noticed that I had all these symptoms. And so, yes, I started gaining the weight. I started having these spikes in my sugar level, and I didn't know what they were tied to. But I was a runner, so that counted for something. And I did eat good, but it was always on the run. And so it really depends. If you're living a healthy lifestyle, you should be fine. And it has to be intentional, ladies. You have to be very intentional with healthy lifestyle when you're going through the menopause shift. Any other questions? Yeah. Okay. Janae, I think you had a question from someone that you wanted to mention.
Does menopause agitate arthritis? And then I know you're going to go into treatment, so it's going to be some of the natural ways to help with menopause.
So yes, we talked about the bone, and we talked about the inflammation. If you're having inflammation, definitely, if you have arthritis, it's going to flare it up even more. But again, you have to practice a healthy lifestyle, and you have to keep moving. Exercise is key, and eating right is key in maintaining or decreasing the stress levels. Any other questions?
I have a question.
Okay.
I wanted to know for the male audience, for their spouses going through perimenopause or menopause, what can males do to support women going through this occurrence?
That is a great question, Donovan. I love that question because Not many men ask because they don't understand. A woman is very complex, but I say to men, get the knowledge, understand what menopause is about, understand what you can expect, and support your significant other, the woman in your life. And so once you know what's going on, I mean, there isn't much that you can do to help other than support her, learn ways to cheer her up, and have the signposts when you know that she's having a mood. Don't just say she's having a mood. You want to say, honey, how can I help you with this? So you kind of you need to get the information. You need to know that you have to hold space for her as she goes through this journey. And the journey is actually for the rest of her life. She could be spending anywhere between 10 to 30 years. So
treat them more precious.
you bet definitely, I mean, all of them would say that, right? Yes, you have to. I mean, men go through andropause, right? And that's their male version of menopause. And so women are so understanding because we're nurturing, we're nurturers, right? And so we notice the shift in men, and men are built a little bit different. And so that's why I say get the knowledge. When you know that your woman will go into menopause and she can have any of these 100 symptoms. Sometimes I've seen women with 30 symptoms. And the thing is, symptoms come and go, and sometimes they're different ones, right? And so once you know, you're going to have more, you're going to be empathetic to her. You're going to want to help, right? You want to be able to take some of that load off of her. Because when a woman is in menopause, I always say you need to slow down. Slow down and take better care of yourself, get back to you, because now you need to become your biggest advocate. Yeah, so that's my 5 cents.
Thank you. Thank you.
All right, you're welcome. Next slide. All right. Now, I included this because women that I know have always thought of menopause as just hot flashes. But my biggest concern is long-term health risk of menopause. This is the biggest thing that women need to understand, because when estrogen drops, and of course, as you age, your body is breaking down. But women in particular, estrogen is tied to everything. So you're heightened for osteoporosis, which is your rapid bone loss, and heart disease, which is the #1 killer in women post-menopause. Women can lose up to 20% of bone density in the first 5 to 7 years of menopause. Isn't that crazy? These things you really need to understand, and that's why I said healthy lifestyle is a must for a woman. When we talk about, I think we had a question about diabetes, and yes, the hormonal changes affect insulin sensitivity and glucose metabolism, and significantly increases type 2 diabetes risk. But again, with healthy lifestyle, you can manage that. And then we have the cognitive decline. Ladies, I cannot stress this enough. Brain fog is so real, and it's so much more than just brain fog. We have so much women nowadays being diagnosed with dementia, and that's really due to estrogen decline. And I really, I'm happy. I think I mentioned a doctor earlier, a neurologist, and she's been given, I want to say, well, it's a lot of millions, but she's been given a huge amount of money to do some research around the link of menopause and dementia. And I can't wait until, I think the research starts next year, and they're going to be completed in 2027. And so I want to really know, what really is the true link and how we can manage that, other than just waiting for it to happen. So yeah, I mean, the risk of cognitive changes affects memory and brain function. You walk in a room and say, no, I left my keys. Where did I leave it? I thought I just left it there. And you say, oh my goodness, where did I leave that? Your forgetfulness. Don't take that light. It's really tied to your declining estrogen. And then another one, which is another big one that's been highlighted recently too, is the urogenital syndrome or genital urinary symptoms of menopause. And for some ladies, they know that that's the urge to pee all the time, bladder issues, urinary incontinence, sexual health challenges affecting the quality of life and relationships. I know it sounds all doom and gloom, but it isn't. This is the time when we need to have the mindset that prevention is better than the treatment. And so healthy lifestyle is very important, very important. So quick question, how many of you knew that heart disease was the #1 killer of postmenopausal women? No?
Thumbs up.
Okay. Okay, any questions?
Yes. This question is, you said women can lose about 20% of bone strength in the first 7 years of menopause. Can you clarify, is it the 7 years since the first perimenopause symptom or 7 years after one had her last period?
Okay, great. So women start losing bone density. It's not really the bone, well, I guess you can say bone strength from the minute perimenopause sets on. From perimenopause, when your estrogen drops, and it depends on what condition your body is in, you start to lose bone density from then. So that's why they put that 5 to 7 years gap in there, because usually it's 2%, but it depends on where you're at with the condition of your body and how your lifestyle is. But that 5 to 7 years is after menopause. So that's post-menopause, because you've been losing bone density from maybe 35.
Okay, thank you.
You're welcome. Any other questions? Listen, I'm here. You need to ask now, because if you want to ask me offline, it's going to cost you. Or send a question in the chat. I can always.
I had a question about health. I guess healthy lifestyles and diet. I understand
Yes.
the exercise element of it, but if you opt to not take anything over the counter, are there any foods or things that can be incorporated into your diet to kind of help reduce these
Okay.
effects or eliminate, if possible?
Great question. Very, very good question. Food is medicine. Food is medicine. I only opt to go on HRT because my endocrine system was disrupted. And so that was the main reason why I went on HRT. But you can eat all of give the nutrients your body needs, like the phytoestrogen foods, like the flax seeds, chia seeds, the yams and sweet potatoes. Make sure that you're getting protein. Women should get, I think it's like a gram in body weight for every pound that you have in protein daily. Exercise, I'm going to speak about that in my next slide. The weightlifting, lifting weights helps strengthen the bones, and walking daily, getting your vitamin D, getting out in the sun in the early morning. We don't want you in the middle of the day doing that, but definitely you want to. Yeah, you want to know that food is medicine. That's where you get your nutrients from. And a lot of women are opting not to do the HRT or NHRT treatment, and they have been managing their symptoms very well. For some women who have a harder time, they go into CBT, which is a cognitive behavioral therapy. Because honestly, we think 40,000 negative thoughts a day, and that can impact the way we see menopause and how we experience it. Because sometimes, it's mind over matter. When you can speak positivity into yourself and practice gratitude and mindfulness, it definitely gives you a different experience in menopause.
We have some more questions in the chat.
Okay, go ahead.
Okay, what are some of the best foods? You answered that. Can Depot Provera improve your symptoms?
Oh, that's a birth control, isn't that? Okay, so let me tell you, this is so good that you asked me that, because I was hoping someone asked me that question.
All right, you got it,
One lady-
LaDonna?
Yeah, again.
Okay,
So someone said to me once,
I am.
can I take birth control to prevent me from going into menopause? And I will say to you, like the doctors say to everybody, menopause is for everyone. Being on birth control may be more harmful for you to continue on it. You may want to opt for the HRT, and believe it or not, your birth control has more hormones in it than the hormonal replacement therapy. And that's a lot more safer as you age. And so there's been studies going out on saying that women who are in perimenopause can opt to go on to HRT, a lower dose, because your HRT that's available today is not the HRT that was available 20 years ago. And again, the HRT was around from the 1960s.
Okay, another question in the chat.
I love these questions, keep them coming. I mean, I do one-on-one coaching, but this is a good platform to ask the questions.
What do you suggest to take to replace the loss of estrogen?
That is also a great question. Disclaimer, I am not a doctor, I am not a medical doctor, but I will say to you that no one woman experienced menopause the same. Every woman experienced menopause different, and so you will have to do your research and your trial and error to see what works for you. For me, I took the estradiol and progesterone tablet, and that I'm like the 1 in 100,000 woman that's allergic to it, and it gave me thrombosis and hypertension. And so I can't tell you what to take, but you need to be aware of what is available. On my website, menoluxspa.com, I have a lot of free information and blog on the latest research and what is available out there, and you can access that and read it. And I also have a guide on how to advocate for yourself with your doctor, and so that's available on my website along with the symptom tracker, which you need to use, because again, once you can track your symptoms, that definitely gives context for when you're going to your doctor and you're going to have a conversation on what is happening with your body. I hope that answered that. Any more questions?
Yes. So another question, can you have any symptoms of menopause in your 30s?
Absolutely. That's perimenopause, right? Like I said, there's 3 stages. It depends. There are some women who go into menopause very early. I had a very close friend of mine. She was experiencing perimenopause from 30. And her symptoms were hot flashes. She had the GSM symptoms, which was the urinary incontinence, bladder issues, UTIs. They were all tied to a decrease in her estrogen. So the answer is yes, but it also depends on you and your lifestyle, your genetics, and the like.
We have more, but we'll go on and then I'll do them at the end.
Okay, great. So our next slide says, why does awareness matter? Because honestly, silence is costly. It's costing women their life as they know it. You know, if you know what to expect in menopause, then you're gonna prepare yourself. You know, we don't want women suffering in silence, thinking that something is wrong with you, when in actuality, you know, it's just a natural stage of life that you're going through, and you have to be prepared. You know, just how they prepared us for our periods and, you know, going into our childbearing years, it's the same thing. The only thing is they didn't tell us about it. I mean, my mom never told me about her menopause symptoms and what she experienced, so I had to figure it out on my own. And so awareness shines light on the symptoms that are brushed off, like, you know, aside from the stress and anxiety, or you're just getting older, or people say, you know, just deal with it. It let us know that what's happening is real, you know, and not only is this just a natural phase in our lives, but this is a stage where we can get educated and we can make better decisions to help ourselves and make this a little more seamless transition that we're gonna go into for the rest of our lives. And so we want you to get the information, be prepared to make informed health decisions about any treatment that you do need or lifestyle changes. Okay. And so I'm gonna turn my camera back on. No? Oh, great.
Yeah, you're good. You can do it. Go ahead.
On.
I just saw you.
All right, good. So my camera is back on. Great. So any questions on why menopause? Or I can take another question.
Okay, another one. Is evening primrose a good supplement to assist with menopause?
Even primrose is good. You know, it's a good supplement. It helps with hormone balance. But again, it depends on what's going on with you as an individual, right? If you're already in menopause, or if you're like me who has a disruption in your endocrine system, evening primrose will only do so much for you. You probably won't see much changes. I tried it, it didn't work for me, and I had to understand why. And so I had to take other measures, but it does work for some women. Any other questions?
Is an increased occurrence of your period a sign of perimenopause?
It could be. It could be. It was mine. Before I had my surgery, I had like some months, 2 periods a month, and sometimes with extreme heavy bleeding. But again, I checked it up to just working hard and being burnt out. You know, I didn't know what to expect. So any change that happens in your body can be a signal to tell you that, hey, you know, we're getting there. You know, I mean, if we understand that a woman was born with all of her eggs that she is going to have to reproduce, you know, of course, by the time you reach 30, you know, those eggs are already depleted because you've had all of these periods, all these menstrual cycles, and so you have lost so much of your eggs, so you're heading into your stage where you're not going to be able to reproduce. You know, doctors tell you when you're 35, and you get pregnant, that's a geriatric pregnancy. So, you know, that speaks volumes to where we're at. Okay. Okay, so any other questions before we move on?
I'll save them for your treatment page.
Okay. All right, so this is the lifestyle medicine for menopause, and I highlighted 4 areas here. Nutrition, exercise, sleep hygiene, and stress management. And I put nutrition as the top because a good diet will definitely change your life. You know, anti-inflammatory foods like the Mediterranean diet, that's the one where we're eating a lot of vegetables and we have your good proportion of protein and your good oils. But that balances blood sugar, adequate hydration. I can't say enough about hydration. If you hydrate enough, you can decrease the amount of hot flashes. I don't know if you see women who are going through a hot flash, they would have ice or cold water, and that helps with it. Sometimes we're not hydrating enough. And just think about the type of supplements that your body will need. Your omega-3s, your calcium, your vitamin D, and again, we talked about the phytoestrogen-rich foods. And those are things that you can really dive into. I have a list on my website of the type of foods and supplements that is recommended during the time of peri and menopause and post-menopause. And so you can get the list from there. But diet is key. I know it's hard, but small steps, celebrate your small wins, and practice makes perfect. It's not going to happen overnight, but as long as you're intentional and you make those changes, eventually they will stick. And the next one is exercise. You have to move. Body in motion stays in motion. Strength training, I would recommend 2 to 3 times per week. Walking, your cardio, yoga, and just a balanced exercise routine that gets your heart rate up, and also to stay flexible, practice light yoga, nothing too strenuous. We don't want you to do what they call a handstand or headstand, nothing crazy like that. So, that is key. You have to be intentional about your movement, especially if you sit a lot of hours in the day. You need to get up, put your monitor on your arm, on your watch, your health fitness watch that says, that reminds you to get up and move, and that helps. So the next one is sleep. And so you need a regular sleep schedule. You definitely need to set the environment in your room for when you're about to have your downtime to go to sleep. And for me, a cool, dark room. I put on my sound machine. I do not drink caffeine anytime after, I think it's like 11 o'clock. But limit your caffeine. I know we love Starbucks. I do have my Starbucks cup right here. But I've had my caffeine fill, and that's me for the day. And another big one that I did not know is alcohol disrupts your sleep. And for some reason, when I'm in post-menopause, and I'm 6 years post-menopause, going on 7 years, and now I'm noticing that if I drink 1 glass of wine, anytime after 6 o'clock, and this is PM, not AM, I will have a very hard time falling asleep. I will definitely be up at 3 o'clock in the morning. And research has shown that alcohol does disrupt sleep for menopause and post-menopause women. So you want to practice mindfulness and relaxation techniques that work for you to help with your sleep. And then there's stress management. And like I said before, once you learn to manage your stress, it will lower your cortisol levels, balance your blood sugar, and regulate your mood. And again, I do the box breathing with the 4 breaths in, count to 4 when you're breathing in, and then you hold for 4, and then you exhale for 4. And I do that for about a minute, throughout the day, and it helps relax and calm the nervous system. And again, that does lower your cortisol. So those are things that you can do to help with your balancing of the symptoms and managing the symptoms. But another thing I would like to highlight is World Menopause Day is October 18th. And their theme this year is lifestyle medicine. And I found that to be very interesting because last year they talked about being inclusive, not only including and supporting women throughout their adolescent and then childbearing years, but include women when they go through menopause. But this year, they are focusing on lifestyle medicine. Like I said, you definitely have to have a healthy lifestyle. We're living longer, we are definitely living longer, and we want to live well. We want to be healthy, and we want to be able to take care of ourselves. Any questions before I go on to the next slide? Okay, great. Next. So medical approaches, I think we talked about hormonal replacement therapy. It helps protect the bones because it's a dose of estrogen, progesterone, and testosterone. Usually the progesterone is in tablet form. You can have it in the tablet form or transdermal patches, topical gels and creams, or again, the bioidentical hormones, which are pellets that are inserted under the skin. Oops. And then you have your non-hormonal options. And with this, SSRIs, they are antidepressant medication that doctors have seen that they can actually reduce certain symptoms of menopause and things like mood and hot flashes, night sweats, the vasomotor symptoms for women who have heart palpitations. For women who have heart palpitations, or women who are having vaginal health issues, they do have creams for that as well. And then you have your complementary therapies, which is the acupuncture for symptom relief, the herbal supplements like black cohosh, red clover, or maca. And then you have your cognitive.
Sorry, can you mute your mic, please?
Mm-hmm. So then you have your cognitive behavioral therapy, and I think I addressed that already. And then you have your hypnotherapy for hot flashes, and some people say that it works for them. So again, you have to get to know what works for you. No two women are alike. And so when you consider your how you're going to treat your symptoms, if you have severe symptoms, you have to figure out which one works for you, talk to your doctor, and they can come up with a solution for you. Okay, next slide. So menopause management is personalized, and I think I said that already. No two women are going to experience menopause the same. It's always going to be different. It depends on your health, your history. That matters a lot. If you're someone who is predisposed to heart disease, cancer, or osteoporosis, those things will happen. What I experienced was, I was a runner. I used to run, I think, 7 miles a day, every day. And when I went into menopause, when I took my first blood test to see where my hormonal levels were, the first thing that showed up was sarcopenia, which is loss of muscles, right? And so that's something that is real. But again, I was a runner, and I didn't know running shreds your muscles, maybe extreme running. But that was something I discovered. And so again, lifestyle factors do matter in this case. And when you're looking for access to care, you have to consider if your doctor is menopause trained. Are they going to talk about menopause with you? Are they going to consider giving you HRT or even prescribing something else for you? And another thing that I learned is that menopause is a natural transition and it's not covered under your insurance. All the treatments to manage the symptoms are not covered under insurance. So that's something that you need to be mindful of. And again, let's look at it from a global perspective. 1.1 billion women by the end of 2025 will be in menopause. 1 in 10 women in the UK leave their jobs due to unmanaged menopause symptoms. And in the US, $150 billion lost annually to productivity related to menopause symptoms in the workplace. These statistics represent real women facing real challenges around the world. In the Bahamas, the context of the Caribbean, 50% of us or more is in the workforce, and we don't hear about HR conversations about support, workplace policies and accommodations, employee assistance program that include menopause, and so women are really suffering in silence. Our policies is probably non-existent for anything that can address menopause wellness. I mean, it's just lumped into a wellness program that happens throughout the year, but there's no focus on menopause inclusion. So these things, there really needs to be awareness around it and changes that can bring that to the forefront. In other countries, there are policy changes happening and bills being passed. So that's something that we need to look into here in the Caribbean. On to the next slide, because I was told that we're running out of time. So we talked about coaching. I do one-on-one coaching. I give you the education that bridges the gap between medical care and daily life management and CBT as well. Of course, I teach you how to track your symptoms and also to advocate for yourself. I do the executive menopause coaching that helps with the menopause inclusive culture, not only policies, but culture shift. And then that's what Menolux is here for. We're here to make sure that we're making that step here to bridge the gap between what's going on in menopause awareness and support in the Bahamas. So key takeaways today: menopause is natural. It's a natural life transition, but it's far from simple. Every woman experiences it differently. The widespread impact is huge for a woman, and especially on the quality of her life. There's over 100 symptoms. Education is key. Education equals empowerment and awareness and leadership. Any company actually can have the opportunity to be included in the menopause training. So reflection here. What's one thing you've learned today that surprised you? You get your last couple minutes to put some questions in here before I tell you about this big surprise that I will be announcing in a minute.
What surprised me is all of those symptoms, 100 and some symptoms is like, I think I have menopause after seeing all those symptoms.
Oh my gosh.
Very shocking.
Oh my goodness. I know, I was shocked myself. It's been almost 7 years now, so I'm sort of, when I think I get used to it, there's another one that pops up, but I'm prepared. Any other questions?
Yes.
Okay, great. I'll take
I am-
two of them.
Hello, morning.
Hello.
One question, please.
Go ahead.
Is an increased occurrence of your menstrual cycle be a symptom of perimenopause?
It can, yes, someone asked that question already, but yes, it could possibly be. That, like I said, that happened to me, and that was a sign that I was in perimenopause. So there are 3 stages to menopause. It depends on where you're at, but that can be a sign that you are in perimenopause. Menopause is when you've had 3 months without a menstrual cycle and a day after. Any other?
Yes, we'll do 2 more. What treatments can help with intimacy and libido changes?
Ooh, that is good. So let me just throw out 2 of them. Maca is that's a natural supplement that helps with libido and energy. And then you have something called an estradiol cream that is for a woman that helps with her any irritation that she may have. It's estrogen for the vagina, and it's definitely one that is safer because the molecules are a lot larger, and so the medication does not go throughout the body, it just stays in that one area. and it restores the balance, and gets rid of the irritability and dryness and in that area.
This is one me and you talked about yesterday.
Okay.
How does PCOS affect menopause?
Oh, girl. I wrote a whole blog on this because I had a client say to me, Patrice, I have PCOS and I know I'm going to go into menopause very early. So after doing my research and writing my blog, PCOS means that you are going to go into menopause later than a normal woman because your hormone levels are going to be up and down and erratic, and sometimes you're going to have a high spike in estrogen. You know, I mean, that's a good thing. That's a good thing, you know, but I was so shocked with that because I thought that PCOS would mean that you would go into early menopause, but that is not the case. I'm happy about that. I hope that's good news. So that's it.
And then Donovan's question.
Oh, it was about soybean intake. I know a lot of research says soybeans are protective because they have phytoestrogen.
Absolutely.
Is increasing soybean intake in terms of tofu or soybean-based foods, would that be protective or supportive in menopause?
It is. As long as you can get your phytoestrogen foods in, then you will help the body produce more estrogen, right? Because it triggers the receptors and also it tells the body, well, we have estrogen, so it's not declining. It kind of tricks the body to say, hey, my estrogen isn't dropping, so let's continue to produce more estrogen. Because we have all of these phytoestrogen coming into the body, so it's a good thing. That's why diet is very important. I say that good diet is good medicine.
Yes, that's it.
Definitely. So after we did that, I want to talk about.
I'll do one more
One more?
because it's
Okay.
a male. I wanted to understand the process more and more. So just about the journey, only to learn that there's a male version as well.
Oh my goodness.
Question: does your expertise surround the male experience, and if so, is there a similar webinar?
That is a good one. I can tell you that I've had this question only because I coached a husband and wife, and the thing that he noticed was he went through depression, he had anxiety, and he had no desire for intimacy. And so that just meant that his testosterone was taking a real dive. And so that's andropause. Those are symptoms. It's almost similar, but they don't have as much symptoms as we do. Yeah, I don't know if it's fair, but anyway, so that's really the gist around andropause. I can't dive any deeper because that's not really my expertise. But from what I know and in my research, those are the key symptoms that men see, and that usually happens for men around the age of late 40s, early 50s. And again, it depends on their genetics and lifestyle. Yeah.
Definitely thank you for that question. That is a webinar we can look at maybe for Men's Health Month. So thank you for that for sure.
Okay, so I noticed that I had a lot of, when I first started Menolux, I had a lot of women saying that, pulling me aside secretly and wanted to talk about menopause. And because it's a shame and stigma around it, like women are not supposed to age. And, we're not allowed to go through this transition when it's perfectly normal. It's our birthright. So what I did for women who wanted to keep their privacy was I wrote books. I wrote books, Your Menopause Roadmap, a guide for transitioning with confidence. So you have the book, it's written Caribbean style, where it's a conversation, hey sis, did you forget your keys today? So this is loaded with all of some good nuggets, everything that we talked about and more, and some good tips. And I didn't stop there. I went and did a workbook, journal to it, where you can read each chapter and go in and start journaling about things that you discovered and things that you want to change about yourself. And so it's really a journey. It's really a tool that can help you change and develop a healthy roadmap for yourself when you're going through menopause. And, you can give it to your daughter, your mommy, your cousin. The husbands can pick it up and read it. They don't have to journal if they don't want to, but definitely You can get this, the link is on my website and it's available on Amazon. And we're giving away a set of these to one lucky person today. But Janae decides that, CG decides that, and so thank you so much for being here and taking in all of this. I know it was a lot to take in today. I'm sure there was a lot of you that were shocked. But again, this is a journey. This is a time in your life when you're becoming, a different version of yourself, and what that looks like really depends on you. I always say that it's a rebirth. For me, I feel like it's a rebirth because now you're coming back to yourself. You're paying attention to what's going on with yourself, and that really is a lot to look forward to. So that's me, and thank you. And if CG invites me again, I'll be happy to come back. Thank you.
Thank you so much, Patrice.
Thank you.
Thank you all so much for joining.